Marshall Curtis. In June 2009, I was diagnosed with cirrhosis of the liver. For treatment, it's important that they understand the underlying cause of the cirrhosis, and so after a battery of tests in August of 2009, I was diagnosed with alpha-1 antitrypsin deficiency, which is a relatively rare genetic disorder of the liver. We realized that the facility that we were at probably did not have the depth of resources that we would need to ensure the best possible care for myself, and ended up transferring my care to Mayo in December of 2009. One of the things that impressed us very quickly, though, was the quality of the Mayo system, and how, with that intense of an appointment schedule, how every time we saw a physician, that physician knew what had happened in the appointment immediately prior and was able to comment on it, was able to address and incorporate that into their diagnosis, into their examination. In some of the final weeks before my transplant, when my condition was the gravest, it was literally at times hour by hour, and yet again the Mayo staff was amazing. They pulled one idea, one miracle out of a hat after another, and bought me one day at a time. And over the course of what turned out to be several weeks, those one day at a time was long enough that an organ did become available that was the right size, the right type, and I did receive the transplant. One of the other complications that Mayo again was uniquely positioned to address was that at the time of my transplant and leading up to my transplant, I was significantly obese. That created a lot of challenges and a lot of contraindications for me being a transplant candidate. And again, they had a staff of dietitians and everything that worked with me, with my family, at length to try and put me on programs that would achieve as much weight loss as possible. They also identified me to participate in a program designed for people in that situation. It involved doing a combined gastric sleeve at the same time as they did the transplant. And I was fortunate enough to be one of the patients in the initial round of that study. That not only saved my life, but it has given my life entirely a new direction. I had struggled with obesity my entire life. It limited a lot of my physical activities, and so now I not only have a new liver, a new life, but I also have a whole new outlook on life, and I have a whole new set of opportunities ahead of me. My vision of life was relatively narrow. It focused on my career, it focused on my family, and at times, unfortunately, I think career took priority over family. I now work as a volunteer here at Mayo, and have had the opportunity that I am able to work with other transplant patients. And, I find that the thing that is most important is being willing to listen. Talking to me or sharing with me is unique for them in that even if I say nothing, I can empathize. As a takeaway from the whole experience is that unique position that I find myself in, and wanting to share that with others, wanting to be able to be compassionate to others, to be able to help others to live and to lean on someone when they need to, and to realize that there is a light at the end of the tunnel, and that there is a hope that you can survive this and that you can make it through, and to help others that aren't impacted directly understand the importance of being a donor, and that when they make that choice, that the magnitude of that choice and the legacy that they potentially leave is beyond description. I mean, you literally have an opportunity to give people a new life. I know that in the last 5 months since my transplant, it's been, the first time I was able to dance with my wife. The first time we were able to go for a romantic dinner. It's like life starts over. I mean, just this last week, it was the first time I traveled for business. and yet I've spent half my life traveling for business. You know, it is truly like somebody reset the clock, and I have a new life, a new set of firsts, and a new beginning. Known as the St. Paul Classic, it's a 30-mile road bike ride in St. Paul that happens every year in September. And at that point, I was just barely past 90 days post-transplant, and we decided that we would do this ride as a family. It shows the dramatic change that I've experienced, not only because of liver transplant, but because of the gastric surgery. And none of this would have been possible without the care that I received here at Mayo. And for that, I'm grateful. I'm grateful for the physicians and the staff at Mayo, without whom this would have been possible. And I am particularly grateful for my donor and for the fact that they chose to give the gift of life. It is a gift that is beyond description. It's a gift that occupies some portion of my mind every day, because I know for a fact that without it, I wouldn't be here.